When someone comes in for an initial consultation face-to-face, it's a very important part of the whole process. In fact, some would argue that it's the most important part of the process because, one, we're establishing a relationship. Two, any surgery that you do, you need to do the right surgery for the right diagnosis. The third thing is trying to determine what a person's goals are. What are their motivations? What are their goals? Are those goals reasonable? Are those expectations reasonable? Those are kind of the things that I'm trying to determine. I'm gathering information, I'm giving them information, and then we're basically starting a relationship in a way, a doctor-patient relationship. And that's really kind of the core, that's the core of medicine right there. It's the interaction face-to-face with each other.